Do dermal fillers really migrate? This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. Filler migration is one of the most talked about topics in aesthetic medicine. Patients often worry that dermal fillers can move around the face after injection. You may have seen images online suggesting that filler can travel far from where it was originally placed. But how true is this? Do dermal fillers actually migrate? Or is something else happening inside the tissues? What people mean by migration. When people talk about filler migration, they are usually describing a change in shape or fullness outside the original injection area. For example, in lip augmentation, patients sometimes notice fullness appearing above the lip border. This may create what some people call a filler mustache. In other areas, such as the tear trough or cheeks, swelling or volume may appear slightly different from the original treatment. These changes often raise the question, did the filler actually move? How fillers behave in tissue. Most modern dermal fillers are based on hyaluronic acid. Hyaluronic acid is a naturally occurring molecule found in the body. In filler products, the hyaluronic acid molecules are cross-linked to form a gel. Once injected, the filler does not exist as a solid lump. Instead, it integrates with surrounding tissues and sits within anatomical compartments. The behavior of filler is influenced by several factors: injection depth, surrounding fat compartments, facial movement, and the physical properties of the filler itself. What studies suggest? With advances in imaging techniques such as ultrasound and MRI, researchers have been able to study filler inside facial tissues. These studies suggest that large-scale migration across the face is unlikely. Instead, what is more commonly observed is subtle redistribution within local anatomical spaces. For example, filler placed in a lip or cheek may spread slightly along natural tissue planes. This can create the appearance of migration even though the filler has remained within the same anatomical region. Second, injection technique plays an important role. If filler is placed too superficially or in excessive amounts, it may spread beyond the intended boundaries. Third, facial movement can influence filler distribution. Areas such as the lips and perioral region are constantly moving, which may slowly reshape the filler over time. The role of anatomy. The face is organized into compartments separated by fibrous septae. These structures help contain filler within specific regions. However, small degrees of movement within these compartments can occur. Understanding these anatomical boundaries is essential for safe and predictable filler treatment. This is why injection technique and anatomical knowledge are so important in aesthetic medicine. Can migration be treated? If unwanted filler redistribution occurs, several options may be considered. In some cases, hyaluronidase can be used to break down hyaluronic acid filler. This enzyme modifies the filler structure and allows the body to gradually clear it. Careful assessment is important before deciding on treatment. Final takeaway. The key point is that dramatic filler migration across the face is uncommon. What patients often perceive as migration is more likely due to redistribution, repeated treatments, or injection technique. Understanding how fillers interact with facial anatomy helps clinicians achieve safer and more natural outcomes. Thanks for watching. If you enjoy evidence-based discussions on aesthetic medicine, please like the video, subscribe to the channel, and feel free to share it with colleagues or friends.